Jody, you've already touched a couple of times on the fact that there was a little hesitation on occasions in asking for help, that you have to allow your daughter to step in and support you, that you have to surrender yourself almost to the people, the professionals around you that can support you through all this. What did you need support with after the surgery? You mentioned that your energy levels were low and that you were going to get through this self-injection. What else did you need support with in the early days after the surgery?
The first 4 days after I left the hospital, I actually went to a neighbor's house, and she had had breast cancer the year before, and so I had sat with her through it. But I remember the day before I went into surgery, I decided that I really I couldn't go back home immediately. There were too many people running around the house and 2 dogs. So I remember sending the email to Jennifer thinking, oh, do I dare even ask her? And it took me a half hour to actually push send. And 15 minutes later, I got this euphoric answer saying, thank you for asking. And that was such an important moment for me to realize that friends and family do want to help. And it's okay to ask. And once I got that wonderful answer from Jennifer, and she and her husband had the whole house set up and everything ready for me, it made it a little easier for me to relax. I also had to ask people to teach my class. And so I asked my daughter, and she taught once. But I had a faculty member actually email me saying, Jody, would you like me to teach your class? And I was so shocked that someone would actually offer to do something for me. And I said, I didn't want to say yes because I was going to put her out. And I went, wait a minute, it's okay. Say, yes, you may teach my class. I'm so excited and happy, and thank you for offering. So it was a huge learning for me that people do want to be there.
And it's interesting because you've already talked about the difficulties with bowel control in the early few days.
Yes, and that continued
we all try and be on our best behavior when we're going to stay with friends and be a guest and so on. That must have been quite difficult, no, to be a guest in a friend's house, nervous, maybe not just about your bowel control, but also about the kind of foods that you might want to eat. It's difficult to ask somebody else to, can you prepare me this, this, and this, no?
Yes, but I got very good at asking finally. The bowel control, yes, that's a real issue. And so I had to become very careful of where were the bathrooms. And I would take my little walks, and I found a little church. And unfortunately, I had to use the bathroom in the middle of a funeral. And so the friend who was walking with me was watching as I was steering myself among all these people who were mourning this dead person as I was trying to get to the bathroom in my jeans and T-shirt. But
it's never a good time.
It's fine. But even up to this day, and it's now been about 7 months, that I look for the bathroom first, and I have really worked on not putting myself in situations. But that's a really tough thing to adjust to.
Before we come back to Dr. Marshall to talk about receiving patients back into the fold who've been through surgery to go on to the next step, you've talked very well about what friends and family have done well for you in terms of the support from your daughter and a phenomenal neighbor that took you in and fed you and converted her home to get you through your recovery. As a cancer patient, obviously as friends and family, we want to do the best we can to support our loved ones physically and emotionally, but sometimes we don't always know what to say or say the wrong things or say it in the wrong tone. In your experience, where did friends and family, colleagues at work maybe say things that were not well received, a bit, maybe said things that were insensitive or asking too much, too little? Can you speak to any negative experiences that maybe can help those that are watching this, family, friends, caregivers, not fall into these black holes of, oh no, I really shouldn't have said that?
Well, I think part of it is, as people said, oh, you had surgery, oh, you had colon cancer, oh my, how do you feel? It must be terrible. That's not overly helpful. My recommendation is to have people ask, how are you doing? And one of the most supportive pieces for me is after I went back to work, particularly in that first month, and first I had said, oh no, I'm not going to need any chemo. And then I met with Dr. Marshall, and I said,
he was warming his hands ready.
Yeah, right there. And I said,
mixing his cocktail.
So then I had to go back to everybody at work and say, well, I'm actually now on chemo. And so people were waiting for my hair to fall out and all these other things to happen. And so what I found was that as they would just poke their head in and say, well, how are you doing? It gave me an opening to say whatever it was I wanted to say. And so I sort of brought them into my little journey. But my recommendation is ask, how are you doing? What can I do? Rather than, here's some advice I want to give you. And it leads to just one other quick point. I found trust being really critical for my whole journey, which is still going on. And trust in the doctors and trust in the system. And in fact, I said to Dr. Marshall at our first visit, after I said no chemo for me, and I trust you, and I'm not going to the internet in the sense of second-guessing anything that goes on. And to me, that was important. I'm sorry. It was very important for me to trust. And every part with the doctors and with the oncology nurse, they renewed that trust.
And for family and friends, caregivers who are watching this, so often in cancer, there are these milestones, surgery being a big one, chemotherapy, but you've talked about the journey, and the journey continues, and at different stages in the journey, you don't necessarily need 100 people offering help the day after surgery when you may be living this for a decade. You need different help along the way, yes?
Yes, you need different help, and the greatest help, and it's happened, even now, friends and family and colleagues come up and say, how are you doing? And that's all that needs to be said, how are you doing? And it means so much to me because it means that they care, they're paying attention, but they're not
putting words in your mouth.
Putting words in my mouth.